Dr. Lief, welcome back to Inside South Florida.
Thank you so much, Anna.
It's great having you, and we learned so much from your expertise on everything we need to know about BPH, right? Which is short for benign prostatic hyperplasia. Can you tell our audience, what is that exactly?
BPH stands for benign prostatic hyperplasia, but most people just know it as an enlarged prostate, which is really, really common as men get older. I see it in men as early as the age 20, and then it kind of stops a little bit until they hit 40 and it starts growing again. So as men get older, the prostate grows, and then they have to come see a urologist and figure out what to do about it.
Right, and it's something that men shouldn't really be scared of because it happens to all men.
Usually, most men, by the time they hit 50, are going to start noticing a slow stream, waking up at night, less pressure in the urination, things like that. And a lot of them wait, but they really shouldn't wait, because the longer you wait, the more damage it could do to your body and especially to your bladder.
I could only imagine. Now, there is treatment out there. Tell us, what are some of the various options that men could have?
Usually we like to start with behavioral modifications. So we tell them to cut back on certain fluids such as caffeinated beverages, sodas, coffee. If they're waking up a lot at night, I advise them not to drink for a few hours before they go to sleep. Alcohol, of course, is going to make you want to urinate more, so don't drink alcohol, especially before you go to sleep. And if that doesn't work, then we use medication. There's about 5 or 6 medications that are around. They've been around for a long time. They work really well, but they have side effects, and they don't really cure it. They just treat it. It's like putting a Band-Aid on an open wound.
One of the treatments that you do have is the Resume water vapor therapy. Can you tell us a little bit about that?
Well, that is a great question, because I specialize in that procedure, and I've actually selected that as my go-to procedure for men with an enlarged prostate. And the reason I did is I looked at all the technologies out there, and I wanted something that was going to be easy to accommodate the patient with, not inconvenience them with the hospitalization. So I could do this either in my office or an outpatient surgery center. The results are pretty quick, and they're long lasting. The company has great 5-year statistics where we've seen patients doing well 5 years. I've actually been doing it over 7 years. It's minimally invasive. It actually, when I have the patient asleep sometimes at the surgery center, it takes about 10 to 15 minutes. I like when the patient is asleep, because I can really focus on the prostate and not have to worry about them moving around. So it depends on how big the prostate is. That determines how many treatments I use to treat that particular patient. Each treatment only lasts for 9 seconds. But they're all done. Yeah, it's incredible. So I put the steam into the prostate for 9 seconds. I wait an extra 1 second before I extract the needle. And then I move to a different spot on the prostate. And depending on how big the prostate is, that's how many treatments I perform. And the prostate has 2 sides to it, the right side and the left side. So if I do 5 on the right, then I do 5 on the left. And then we wake the patient up, and they go home the same day. And in a couple of days, I remove their catheter. They can resume work the same day or the next day of the procedure. And within a few weeks, they're going to start seeing excellent results as far as their urination. And eventually, my goal is to get all of these patients off of the medication. This procedure is also great because it has minimal sexual side effects. Some of the more invasive prostate procedures can affect your sexual function, and we have found, and especially I found, that this one has the least side effects as far as men's sexual function goes.
Well, that's great to hear. And who can benefit from Resume water therapy?
People that are on medication that are not responding, or people that just want to be off medication. Some people would rather have something fixed than take a medication for it.
Right. And now, you've mentioned a few reasons why it's a great option, but what's another key item on why this is a great option for men that are suffering from BPH?
Why? Because it has long-lasting effects. It's going to help you urinate better for many years. You get off your medications, which can be expensive or have side effects. It doesn't affect your sexual function, and it is covered by almost all the insurance companies, so there's very little out of pocket for this. It's a very well received procedure.
Absolutely, sounds like an amazing option. Dr. Lief, thank you always for joining us here on Inside South Florida and sharing all your knowledge with us and on everything we need to know about BPH. Where can we find you?
Oh, thank you, Anna. You can check out my website. It's liefurology.com. Office phone is 954-755-3801.
Dr. Lief, thank you so much for joining us on Inside South Florida.
Thank you.
If you would like to learn more about Resume water vapor therapy and how it treats the cause of BPH symptoms, be sure to visit www.resume.com for more information.